This is a global shortage.
Doctors and other health professionals are becoming increasingly concerned.
Hi, I'm Natasha Robinson. I'm the Australian's health editor. Well, you might have heard that there's an IV national saline drip fluid crisis in our hospitals. The situation is very serious, with many hospitals down to really critically low levels of supply, even running out of bags in essential areas, maternity, emergency departments and resuscitation units.
There's a shortage around Australia of bags of intravenous fluid that are used for medical purposes. It's patchy, it's not affecting every hospital, but in some places it's beginning to have quite severe effects. I'm a surgeon myself, and earlier this week we didn't have some of the fluids that we need for the surgery I do and had to do workarounds. And I'm hearing this right from around the country at the moment. So it's got potentially serious consequences for patients and the health system.
These IV fluids are critical in all aspects of healthcare. They're critical for replenishing the body's dehydration in cases of severe blood loss and also when people have experienced severe wounds. They're used, right across the board. If you've ever been in a hospital, you have seen them.
So when we think about IV fluid shortages, which is sterile salt water, we are actually thinking about the whole healthcare system. So that is for our ambulance services, through to GP clinics, to dialysis patients, as well as private and public hospitals. So the ramifications of this is quite extraordinary. It's been quite unclear why Australia is experiencing this shortage, which we have never seen the likes of before. It was initially reported that this was a global manufacturing issue, but we at the Australian have looked into the issue and approached countries around the world and found that no other country, effectively, there's some isolated issues in Taiwan. Other than that, no other country is experiencing this shortage of IV fluids that we are. What the suppliers are saying is that it is a global shipping issue. There is a problem getting these IV bags into Australia via shipping routes. There's a shortage of shipping containers, and that crunch on our importers, the suppliers who supply to us from overseas, is placing this additional pressure on Australia's manufacturer onshore, which is the international healthcare company Baxter. The Australian has established that Baxter also supplies New Zealand all of its IV fluids under an exclusive contract, and they have clauses built into their contract which puts penalties on Baxter if they don't supply. New Zealand has no supply problem, yet all of their IV fluids are coming out of a factory in Western Sydney.
Well, the reasons for the shortage are actually the similar reasons that we have with a lot of other medication shortages. That is that we actually can't manufacture enough for our population. And so what we do is we import from overseas, and in the case of medications, it's over 90% of our medications are actually imported from overseas.
Many of these factors are out of our control, but what is in our control is national coordination of procurement of this vital aspect of healthcare. At the moment, states contract with essentially Baxter, state by state, and there seems to have been breakdown in the process in which nationally this issue that was a growing crisis that the states were issuing emergency alerts about as early as early May. And yet we were not told by the TGA, which is the national regulator, that there was a shortage. And that was because this medicine is not actually regarded as a reportable medicine, which would require them to report that shortage on their database. The shortage was reported in an alert nationally by the TGA, by which time hospitals were quite literally running out of supplies. This raises really critical issues of how we secure and guarantee supply of this critical aspect of healthcare service. There is clearly a need for some kind of early warning system, a national coordination of procurement at the Commonwealth level to make sure that, something like this, to the extent that it is controllable by us, doesn't happen again.